Welcome to the Mumbai Piles Clinic. Here today we are with Dr.Sambit Patnaik, colorectal surgeon, who is going to discuss about the laser treatment of fissures. So first and foremost, hello Dr. Patnaik and welcome to Mumbai Piles Clinic.
How are you?
Thank you. And thank you for giving us a time and opportunity to discuss this with you. First and foremost question that we all have is, what is a fissure?
See, fissure is nothing but a small injury to the motion passage. You get a cut in your lip, a sharp lip. Similarly, the motion passage gets injured. And once it is injured, this injury causes this crack in the passage, which is known as fissure. So fissure or fissure in ano is nothing but a small linear injury, a line-like injury or a crack in your motion passage.
How do we know that we actually have a fissure?
See, like I told you, fissure is an injury. So any place that is injured hurts. So pain, burning while passing motion is usually an indication of fissures. Some patients do have bleeding, but bleeding is scanty. It is not very profuse. It is very rare to have profuse bleeding with fissures. So you usually know that you have fissures when you have pain while you pass motion, and yes, you feel that tightness of the passage, constriction of the passage, and maybe small little skin tags hanging outside, which are again very tender, which give an indication that you have fissures.
What are the common causes of fissures?
See, primary fissures which develop just like that, are usually because of passing hard stools. Straining to pass hard stools would overstretch your passage, and your passage would crack, and you would have something known as a fissure.
What do I do if I have a fissure?
See, if you have a fissure, you should never self-medicate. You should immediately go and see a doctor. The doctor needs to just examine you, and trust me, a doctor will never ever hurt you. So don't be worried that there will be an examination with a finger or with a camera. No, a doctor will just see you and gently examine you and will tell you you have a fissure. Once you know that you have a fissure, well, yes, go ahead with treatment. But do not presume that you have fissure, and do not start self-medicating.
So what do I do if I have a fissure?
See, if you have a fissure, you should go and, like I told you, go visit a doctor, and the doctor will tell you that you have fissure, and he will give you a certain set of medications, and you put yourself on medications. And if you are advised any further treatment, then you should wait for your medication to act, and then go and check again with the doctor and see what next needs to be done.
What are the treatments available?
See, if you are asking me about laser surgical treatments, today fissures, they just require a minute or of treatment. We need to establish they are a primary fissure. There is no other cause, bigger medical cause for fissure. Simple fissure, they are treated with a laser sphincterotomy or a sphincterolysis or Botox injection, and these are all 1 minute procedures. They would relax the passage, they would keep the control mechanism intact. They are just a minute odds procedure, and you are instantly cured. There is like instant relief. When you go back home, the pain goes away, the bleeding, if at all, settles down, and these are all daycare procedures. They are walk in, walk out. You just come in, get the treatment, and walk out. So it just takes a minute to treat a fissure with laser. Yes, it is about come in the morning, go in the evening kind of scenario of daycare that we treat fissures.
Wonderful. Thank you so much, Dr. Patnaik, for giving us so much information. And I hope everybody, you just reach out to Dr. Patnaik at Mumbai Piles Clinic if you have any problem regarding fissure, if you think you have a fissure. Thank you so much. Thank you.
Thank you.